I'm here with the man of the moment, Bob Gill, today, Dr. Bob Gill, to discuss the misframing of the NHS debate. Is the NHS on the table, or has it in fact been part privatised and almost the whole way fully privatised in many aspects quite some time ago, as of 2012, as of before that? Let's find out. Bob Gill, how are you?
Hi, Ranjan. I'm fine. Nice to talk to you again.
You've just made a film, haven't you?
Yeah, it's been over 2 years in the making. It's been a struggle getting it done, but it's out there now, and we've put it out onto YouTube in the run up to the election because we think this is a pivotal election, and potentially either we save or we lose our NHS.
Okay, so could you just tell everybody what's the name of the film and how and where can they watch it?
So the film is called The Great NHS Heist. If they look at our social media, greatnhsheist.com or the Facebook page, they'll find a link to the film on YouTube, and we've let it out for free in the run up to the election.
Okay, you've only just made the film, haven't you? Or at least you've only just released the film. I went to see it last Saturday at the cinema.
Yeah, we got everything together. We realized that this is a key time, we think, in the history of this country to try and make a difference in the direction that the country takes, because the fear is, certainly with everything that's gone on since the 2010 election, that the NHS and other public services are being smashed apart and handed over to private concerns. Yeah.
Okay, so before we get into all of that, yesterday there was a TV debate. It was the second TV debate between Jeremy Corbyn and Boris Johnson. And I was watching some of the BBC coverage before, during and after. I have some observations. I'd like to go into that at some point. But just to say that as far as I could see, beforehand, they said, oh, Jeremy Corbyn's really going to have to pull something out of the bag. This is BBC bias. During the event, Nick Robinson, who I believe was the president of the Young Conservatives when he was at university, he was hosting it in Maidstone, so quite rampant Brexit land. And he said the only time he really pulled anyone up, he looked at Jeremy Corbyn and he said, you sent out an email to the whole country in which you said people could be waking up to, how would you feel if you had a 5-figure bill for your cancer treatment? And then he said, it's time now to admit that that this is misleading the public like that. Bob, this morning I was on the internet and I saw a video of somebody who is a victim of the Windrush hostile environment scandal, who said that he had prostate cancer. He assumed he was about to get treatment, and they said, we need 53 grand or 54 grand. And that was said to him straight. So that's on the basis that he doesn't deserve it, that he is not English. But hold on a second. Privatization only respects money, right? So 5-figure bills would be normal. Jeremy Corbyn came back with a brilliant answer. He said, that is the logic of privatization. He didn't kowtow or anything like that. This is, I think, something that people could be worried about. Could you just talk a little bit about this? The 5-figure bill that people could be getting. I'm not saying that
it's happening now. So if you go to one of the tertiary cancer centres in London, there is an NHS stream and there is a private stream. You will get certain amounts of treatment on the NHS, and if you want further treatment, then you have to look into how you're going to pay for that treatment. So that is happening now. And Nick Robinson needs to get out a bit more out of the Westminster bubble and see what's happening on the ground. The Labour Party and Jeremy Corbyn are rightly banging on about privatisation. To my mind, they're picking a very narrow spectrum of the privatisation, which is the drug bill and also these trade deals. But they are missing out the 30 years of stealth privatization, which we uncover and explain in our film, which goes back to Margaret Thatcher and Oliver Letwin, John Redwood's pamphlet back in 1988, which sets out several key steps in the privatization, most of which have been complete. The only bit that is left to be done is for the private insurers to take control of the budget and to get people used to the idea of charging and facilitate a middle-class drift out of the NHS taking up top-up insurance.
Okay. In London, where I am, the London Borough of Wandsworth was a Conservative flagship council, and in 1979, Christopher Chope, of upskirting fame, he was the head of Wandsworth Council, and he was the first person apparently to outsource the bins. That's how it started. And I'm just saying this because I've looked at Britain's biggest enterprise by Redwood and Letwin, 1988, Centre for Policy Studies. I've seen that document and the list of things that it says. I remember even 15 years ago seeing that those things had already happened. I only read it probably about 4 or 5 years ago, but it starts off with what they call contracting out, so the cleaners. So in the same way that Wandsworth started with the bins and eventually they sold off the housing. I mean, children's homes got sold and kids got farmed out, and they were abused in the other places where they were going to. So actually that was a case of privatization driving paedophilia, people taking advantage of the vulnerable. The Britain's biggest enterprise starts off with the contracting out of the cleaners, which, as your film says, relates to hygiene ultimately. Could you give us the other examples along the route, or what, how's this been going on then?
So you're absolutely correct. They started off with ancillary services, arguing that this wasn't really healthcare. So cleaning, catering, portering, the laundry, all those key elements of ancillary work had been sliced away from the NHS over the late 80s, early 90s. It wasn't until the Blair-Brown government in 2000, for the first time, we had the outsourcing of clinical services. These standalone independent treatment centres came on stream because our friends in the private sector were so desperate to help the public out that they were willing to take away easy, profitable surgery out of the NHS. Now, this was sold to the public as our lovely commercial partners wanting to help us cut waiting lists. The reality was this was a wedge to drive in private provision of clinical services for the first time in the history of the NHS. And that was a new Labour government that achieved that major milestone.
Okay, so they opened the door.
Yes.
And then in 2012, what happened? Because that was obviously not the Conservatives anymore.
Well, in 2012, the bill effectively abolished the duty of the Secretary of State to provide healthcare. So, abolishing the NHS in legal terms, all he had now was a duty to promote healthcare. So he became an advertising agent. And also part of that bill was the compulsory tendering out of all services.
What does that mean?
And that means every contract has to be parceled up and put out to the private sector.
Okay, question. If in 2012 there was a change that went from opening the door to making it even more blatant, the fact that everything has to be sold as a service and you have to decide upon different people who are competing to run that service, who makes the decision to decide who gets the service? This is a question that I think I know the answer to and I don't like it, but I'm going to ask you. Who makes the decision about who gets those contracts?
Well, the other plausible narrative that they ran with in 2012 was putting doctors in charge of commissioning services. Now, this is where the GPs, the family doctors, were set up into clinical commissioning groups. These were budget holding organizations which were in charge, in fact, in slicing apart NHS services, hospital services. So they gave the power, theoretically, to the local GPs to decide on who gets hospital service contracts. The reality was there was always a push to cut down the cost of these contracts and also hand as much as possible over to the private sector. There was no other reason for it. There is no country in the world. Let me just finish this point, Ranjan. There is no country in the world which has a privatized system which is capable of providing universal health care to the whole population. It does not exist on this earth. So what the government is doing is willfully setting up a system which will neglect a significant proportion of the population, and the rest of the population will be at the mercy of private insurers and private providers. So the targets of these reforms aren't the poor and the sick, they'll be abandoned. The target of the reforms are the middle classes whose wallets will be aimed for by the drug companies, by the insurers, and the hospital providers.
Right. So the target is to get middle class people on the NHS books and to forget about everyone else. Is that what you're saying?
Look at it in this way. So the plan is to have a much increased spend on healthcare, not from the state, but from the individual. So in due course, you will have a transferable NHS budget where you can take off to a private insurer. So you buy top-up insurance to try and replace what the NHS used to provide, but no longer does.
This is like the US world of deductibles and everything like that, isn't it?
Exactly. So we're entering into a system very similar to the US, where you have Medicare and Medicaid, which is tax funded, to provide a safety net for those who the untouchables in terms of the insurance industry. So the state steps in with funding for residual care for those people. Meanwhile,
so we're talking about old people and poor people, according to the demographic.
So you will have something like a single payer system which will provide you a certain degree of healthcare, and that will be tax funded.
Okay, so in terms of systems, so you've got universal system and you've got single payer, right? These are terms. So which universal sounds like everyone can be treated, and single
but they're not
payer,
getting the same thing. So the state will provide a basic budget for everybody
in the future.
In the future, the total cost of health spending, adding together state and individual, will roughly double. Middle class people will have their state element of state funding, to which they will top up with private insurance, and that whole budget will be looked after by the private insurance companies. People who just have state funding.
Hold on. You just said the whole budget will be looked after by the private insurance companies. So this is slightly going back to what I was asking about before in terms of, so I said who makes the decisions for who gets the contracts. I was talking about, the large companies that get big contracts, whether that be for drugs or devices, or more to the point, delivering the service. And you said they made it sound like it's the doctor. So in business, when people talk about putting a contract out to tender and making the decision, it sounds like this current system, they say it's commissioners, and it's a bunch of doctors doing the commissioning, deciding who's going to provide the best value for the service. Is that roughly what we're being told?
I think it's important to keep these two elements separate. You've got the commissioning of services.
Yeah.
And then you've got the money, right? So you have the commissioning of services, which at the moment supposedly is being done by groups of GPs.
Right.
And they are saying to either public or private bodies, you will provide this service in the future. You will provide, let's say, for example, the diabetes service for this community. That's a separate discussion. That's not talking about the money flows. What I've just been describing is the money flow. And the future will be an element of healthcare funding coming from the state and an element of funding which will come from the individual. Sure. The total of which will be more than double what we currently spend per head of population in this country. So the cost overall, state plus individual, will double, resembling what's happening in the US, without any gain in healthcare. That's the point. The outcomes will be worse. People will be spending double and having to live with the uncertainty of whether their insurer will actually pay out despite them paying premiums.
And what's the name of the system? So basically the doctors doing the commissioning and deciding what you get, not money, that's called commissioning.
That's called commissioning.
And so what's the thing where you were saying that the insurers will be in charge of the budgets for who gets, for the money, basically? What's that called?
It's the control of the financial flow. So let me give you an example. In the US, United Health was commissioned by the state.
That's the huge US health insurance company that is huge in the UK as well, by stealth.
It's getting there. So United Health was providing the IT and the algorithms to manage the state element of funding, Medicare and Medicaid. So you have an insurance group in charge of the purse,
right,
as well as their own private policies. Do you see?
Yeah. Are they already doing that here?
They are in place here. They have a presence.
They are doing that here.
They are doing that here, yeah. So they're key in implementing the reforms. Their personnel are all over the NHS. In particular, one key person, Mr. Simon Stevens, formerly president for global expansion for United Health Group. So
He's what's his job
they
now
are
here? What's his job
positioned.
here? What's his
His
job here?
job here is chief executive of NHS England. And
Okay.
he's the man with the day-to-day responsibility for running the NHS, not Matt Hancock, who has now more of a ceremonial role for PR purposes. He has no day-to-day control of NHS. He just issues one mandate a year to Simon Stevens.
Okay, so Simon Stevens, that's a deep revolving door. I understand that he was president of the Oxford Union, like Boris Johnson was. So, that's sort of quite a prestigious thing. He was always destined for great things. So he's doing this. He was advising Blair, went out to America, has come back. But going back to this thing about Optum or United Health controlling budgets, they're already doing that. So when you say they're already doing that, are you talking about unofficially through Simon Stevens or Optum itself, the actual firm? What are Optum actually doing in this country? If you could give me any sort of a picture, that would really help, because they're the big bad guys here, without meaning to
Yeah,
reduce things down to the simple. What kind of things are they doing? If you could start off with the most significant things that they're doing.
they are reshaping the NHS in the image of the American insurance system. Their key personnel are leading changes. They're educating the NHS leadership. They are implementing the ethos of insurance, the terminology of insurance, the structures of how to run private insurance throughout the NHS. They are also entangled in referral management. This is a system of, at the moment, controlling GP referrals to secondary care. But
Oh, what, like surgery and stuff like that?
yeah, so if I refer somebody, it will go to a referral management center. Now, at the moment, vast majority of them go through without challenge. But what I'm starting to see more of is my referral being challenged by an administrator who's never seen the patient, who's trying to second guess whether that referral is appropriate.
Well, is there
Now,
a
this
cheaper
is,
way of doing it, sort of thing?
well, can I block it? That's the point, because the American system is designed on the denial of care. And what they are doing with GPs at the moment is normalizing the concept of your referral being blocked. So GPs are now used to this happening. They see it as an administrative nuisance, but in due course, this will become the norm, and particularly expensive patients will be blocked from receiving care. But what is most perverse is the building in of incentives for the GPs to play ball. This is called the shared savings scheme, which has been incorporated into Simon Stevens' long-term plan, which will give the GPs a cash bonus by performing in a certain way. And that performing is to reduce referrals. If you remember from the Watergate tapes, there was a revealing conversation between Nixon and his advisor, Ehrlichman. And the key line there was, the less care you give them, patients, the more money you make, the insurers. And that's the game that our country is playing with people's health. That's the game they've embarked upon.
Okay. I've seen documentaries about the opioid crisis in the US, and it feels like the US system is set up for that, or at least it's set up in such a way that that kind of thing can take place. I haven't considered this before, but if we're going to open the door onto the US system here, then all of the incentives will be, for insurance firms to be used, blah, 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 until, they can't afford these heavy drugs anymore. And then people are addicted to drugs and they won't be able to get them anymore. And then they'll go onto the street, et cetera, et cetera.
Yeah, I think that you raise a very current impact of how dysfunctional the US system is. It's primarily driven by profit. You had a company, Purdue Pharma, who marketed their addictive opiate drug OxyContin as being non-addictive. The marketing was very slick and downright disgusting in some respects. They were employing models and lap dancers to go and entice doctors to
Right.
prescribe their drug. They made false claims about the drug not being addictive. Then you had people who were given this pain relief for simple procedures who ended up hooked on this heroin-based drug. And in due course, as their lives fell apart, they were no longer able to work. They lost their health insurance, which was related to their work, and they ended up using street heroin. And that has led to the massive overdose problem, to the extent that there's an estimated 400,000 people who have died as a consequence of the opioid epidemic. And if you look at the root cause of that, the root cause is the healthcare system in America, which is deregulated, which is a wild west of drug companies charging what they like, doing what they like, claiming what they like, and the FDA in the pockets of these companies, letting them
This is
do
the
what they
Food and
will.
Drug Administration, the people who
This is the
decide whether or not something is
regulator.
safe.
This is a regulator for the drug companies. So you have this very corrupt, cozy relationship between policymakers in Washington, lobbyists from the health drug companies, from the providers, from the insurers, and these companies pay the regulator. So you have politicians and lobbyists and regulators all working to the same end, and that end is to maximize the profit for the corporations. It has absolutely nothing to do with health. For a patient to receive a good health outcome is a lucky byproduct of the system. The intention of the system is to generate money through whatever means possible.
Okay, so getting back to where we are here now, because I mean that's at least two nightmare scenarios that have already started that you're talking about. Where do you see things going? If so, let's say people tactically do what they can to keep the Conservatives out, and either hung Parliament or Labour winning. Let's just be optimistic from the perspective of the country's healthcare. Then what things do you think ought to be avoided or need to be done? Because at the moment, I get the impression that Labour aren't really recognising the danger of United Health or Optum or Simon Stevens. They've gone down this road of very simply saying, trust us on the NHS, trust us on the NHS. You know, we won't do PFI, etc., etc. But what do you think is actually necessary at this stage?
So if we get a Conservative majority, the plan will proceed uninterrupted. You will have a steady decline of the NHS, particularly emergency services like casualty and acute surgical and medical admissions. Patients' experience will become worse and worse. The mainstream media will play their part in terms of demonizing the NHS as a structure. As all these negative headlines get reported again and again, you will slowly have a eroding of confidence between the profession and the patients in the system. This will facilitate a drift out of the system by the middle class, who will choose to buy top-up insurance, falsely believing that this in some way will help them out in the long run. The other catastrophe for healthcare in this country is those people with experience, those people with organizational memory, those people with a conscience who have the option will leave the NHS. So you have a downgrading of the workforce. The organizational memory will go. The ethos has more or less gone, or it's difficult to practice with a public service ethos in the NHS anymore. So you can imagine the devastating effect on the patients. Patients will be getting substandard care in overstretched services delivered by underqualified people, very often not even a doctor or a qualified nurse, but something else, something inferior, like physicians associates, nursing associates. These are people who have been deliberately brought into the system to cut the wage bill to maximize profit. So you will have this skid row service and a middle class potential get out if they get top up insurance. But the problem is nobody is safe in this system, because when you become seriously ill and expensive, the insurers will be looking for a way out to dump you as quick as they can.
Right. Okay, well, it looks like you've gone for the most likely option as opposed to the optimistic ones that I was going for.
Well, I'll come to the optimistic one now, if you like. So let's assume Labour have control.
Yeah.
The Parliamentary Labour Party has a problem. There are still many neoliberal Blairites within the Labour Party.
especially in the
who,
Lords, right? Especially in the Lords, right? The Labour Lords are
yeah, so
deeply.
they
They've
are
got all
quite
the interests.
happy. They would be, I suspect, just as happy for a Conservative government to continue. But if Corbyn gets elected, well, he has a fight on his hands because he has a significant proportion of the PLP, the Parliamentary Labour Party, which have tried their best to get rid of him in the 3 years he's been leader, have so far failed, but they will not allow him a simple task of getting the privatization stopped and reversed. So it's whoever gets into power, it's absolutely essential that the public wake up to the threat and do not allow our political leaders to sell us out to American corporations.
Okay, but you still haven't really said. I mean, you've basically. I mean, obviously, you were asked to be honest. So what you've said is he'll come in and they'll just try and undermine anything he does.
Okay, so
Obviously,
if
which
he's
they,
successful, let's say
yeah.
he resists
Yeah.
um, the forces against him within his own party, what should he do? Number one, he needs to look at the leadership of the NHS and start at the top. Start at Simon Stevens. What is an insurance guy doing in charge of the NHS? He must go, as must all his privateer colleagues who serve on the Quango, which is NHS England, which is in fact a privatization board. So we need to eradicate the influence of the big four accountancy firms, the management consultants, the bankers, and United Health operatives who have dominated NHS leadership positions. That's the first thing. We need a regime change at the top of the NHS. Second, he needs to tell the staff that we are returning to a public service to stop the hemorrhage of experienced staff and say, look, we are no longer at war with you guys. We respect what you're doing. We're going to reward you for looking after the patients. We're going to return some of your terms and conditions that were removed. So we stop the situation from getting any worse. And then in terms of legislation, we need a straightforward act of parliament which repeals all the privatization legislation that has taken 30 years to get us to where we are and gets us something close to the 1948 settlement, which is a publicly funded, publicly provided, comprehensive health care, which includes dental care, eye care, and everything else that has been gradually sliced away from the NHS ever since 1948.
Well, I think it's time for me to be a little bit difficult. You've been very good in terms of just getting straight to the point with your answers, but can I now be a little bit difficult?
Sure.
Now, let's say you go to a 1948 situation. Brilliant. But then what about the evolution in technology, artificial intelligence, etc., etc.? How does one take advantage of the stuff that's helpful without getting rinsed? Because you can't just say, oh, everything's going to be made in England. So, people and devices and whatever it is that's out there and drugs, etc., etc. How does one go about making sure that one is still getting as good a level of access to what's out there as possible? Because it would be very easy to paint what you've just said as a return to 1940s technology or something like that. Do you know what I mean? People could just say, right, okay, you're against everything private, aren't you? You want everything to be made at home, therefore you're backward, you're a grey, miserable socialist. So what's your answer to the actual business side of, not even business side, but kind of just making sure that people get the best, or, as good as we can afford? Are we going down a North Korea road, or, what do you want?
Okay, so the NHS has never been a North Korea road. If you look at the NHS, it has led development in healthcare as a system which is publicly funded and publicly provided. We were leaders in transplant surgery.
Right,
We are leaders in public health,
right.
immunization, nutrition, preventative care, universal antenatal care. We led the world on all those developments, and we continue to lead the world on development in delivering medical care. Nobody is saying let's put our heads in the sand and ignore modern technology. What we are saying is let's assess the technology on its merits. Let's not get caught up in the marketing and the advertising. Let's test things robustly. And if they work, we adopt them within the NHS. But we use NHS monopsony buying power to get the best deal. We do not break the NHS up and get every small area to buy their separate MRIs for the country. We go to the MRI producers and we say, we're going to buy MRIs for every hospital in the country. What is your best price? Because we are the biggest buyer of MRIs in the world. That's the power that the NHS needs to use. And it also needs to use that power with drug companies. And we mustn't fall for the spin that's coming from the free market fundamentalists that the private sector is the source of all ingenuity. If you look at most developments in the internet, in AI, it comes from publicly funded organizations. MIT in the States, the military wing of the United States Army. These developments have been commercially mobilized and profits extracted, but the research wasn't done by commercial entities because it would be cripplingly expensive. They've just exploited what the public has funded. 99% of the technology in an iPhone comes from publicly funded research. So it's a myth that the private sector is all entrepreneurial and innovative. A lot of innovation comes from publicly funded programs, and that's the re-education we need to do to the public. They're falling for the glamorous advertising. Let's cut to the chase. In terms of investment that has occurred in the NHS where we've been sold a dud. And I'll name one example, Connecting for Health, which was a program to put all medical records onto a national database stem. That was, interestingly enough, had some Simon Stevens involvement. It was classed as the biggest public IT procurement disaster in the history of procurement disasters, wasted £16 billion.
My
In
God.
some mad headlong rush into adopting some fancy new IT system.
So what balance sheet? What balance sheet does that appear on? I mean, or disappear from?
Well,
it's
from NHS budgets, and this was in the mid 2000s, and it was a disaster, and everybody's forgotten about it. But the people who led those disastrous decisions are still floating around in healthcare. You would have thought they would be untouchables, but no. It seems that if you have a disastrous record, you get promoted in the NHS. And that's another thing that we need to tackle. We need to promote people on merit and not on their own personal commercial ambition, and not because of their access through the revolving door that you mentioned earlier.
Right. Okay. Well, I think we've covered a lot of good stuff. You've obviously been going up and down the country for years now. I suspect 4 or 5 years at least, and spreading the word. Now that you've made your film, can I ask you a question?
Sure.
Will you now be a bit freer to do regular Thoughts of Chairman Bob?
Well, I'll be freer to, because this problem isn't going away, and we still need to get the word out to as many people as possible. Yeah, so I'm happy to do more interviews and anything to help stop us from pursuing this disastrous route.
All right, brilliant. Well, I think, although I would be very happy to continue for a while, I'm going to say it was good to speak to you the day after the TV debate. Oh, there is one thing I wanted to say. I mentioned this to you earlier on the telephone, which is that when talking about privatization yesterday, Boris Johnson said, the worst privatization came under Labour with PFI. But just a few seconds before that, Jeremy Corbyn said, you said you were building 40 hospitals, but you're only building 6. And Johnson said, yes, I am only building 6. That's right. We've got seed funding for the rest. So he's only got the money for 6. He's claiming to have seed funding for the rest. That sounds like he's doing more PFI, financial engineering to talk about how to pay for the other 34 hospitals.
Yeah, and seed funding means nothing. And it's using the term from the City of London, implying that private investors and private equity might step in. This is more privatization. He can dress it up as he likes. But PFI has been a disastrous scam on the public purse to enrich the bankers. And Boris has a good track record of defending bankers. He said it himself.
Well, on his register of interest, again, that didn't come up yesterday either. There's £22,000 a month that he's got from the Daily Telegraph, plus thousands of pounds that he's getting for his speeches at banks, insurance firms, all of these different things. Obviously, this is until July when he came in, but at least Tony Blair waited till after he was a year gone before he bought his house in Connaught Square at the top of the market. This guy, I mean, he's pre-revolving door. He is getting thousands of pounds even before he becomes prime minister. I'm not talking about royalties from his books. He's just getting paid everywhere.
And also money he diverts to his girlfriends, and how he managed to lose his security protection and go off to a Russian oligarchs party in Italy, from what I hear. So he's a security risk, as well as he's got his fingers in many different pies while serving as prime minister. It's quite disgusting, really.
And when you hear him on the television, and he's the way he interrupts himself with his hesitations and everything like that. At least Blair, who I didn't particularly like, but he could start a sentence, slow down, change the direction, and fuck everyone completely. But he was good at that.
Boris is he's not a master communicator, but he seems to get away with the buffoon act.
Yeah, I mean, what I think is unbelievable is the hesitation as a tactic, that the mumbling and whatever it else. He actually doesn't speak very well, no. And the way that he hesitates and everything, I'm starting to realize that he is a sort of, I mean, if you look at his register of interests, the guy is a rent boy, and he doesn't know whether he's coming or going. I mean, he's literally in the service of so many different people that he doesn't even know where it's coming from.
He's certainly not in the service of the vast majority of the British people.
And with Crosby behind him as well, who's literally a lobbyist.
You couldn't make it up. You couldn't make it up. And, the Labour Party need to bring these conflicts of interest to the forefront.
Bob, good talking to you. I look forward to the next time. Thanks very much.
Thanks very much, Ranjan.
Just to say, could you just, again, let us know about your film? What is your film and where can people watch it?
Type in thegreatnhsheist.com and look for us on social media, and you'll find a link to the film.
Thanks very much. All the best.
Thank you. Cheers.